Welcome to the Above Center Leadership Podcast. I'm Marcy.
And I'm Allison, and this is our chance to learn from leaders who know how to get results while staying above center.
Let's get started.
Welcome back to another Above Center Leadership Podcast. I am so excited to see you again. And today we are lucky because Kyle Dorsey is in the house. Kyle is president of Baptist Medical Center South, which is ranked U.S. News and World Report as one of the top 5 hospitals in Florida. So congratulations to you and your team, Kyle.
Thank you so much, Allison.
Tell me what it's like to be leading. I mean, I imagine how many people are within the hospital system?
Yeah, so Baptist South is one of 6 hospitals within the Baptist Health Enterprise. In total, we have about 15,000 team members. Of those team members, about 1,800 of them work on our South campus.
It's one of those things when you think about yourself as a patient going to the hospital, you just have certain level of expectations. But then when you hear about the volume of people you employ to make it happen, especially because it's 24/7, I'm so excited to talk to you about some leadership best practices around hiring.
Yeah, no, people are what make the difference. I think the big difference with healthcare is, we can't do anything independent. Everything's done with a team. And I think our hiring practices and making sure we have the right team that's representative of our community and the leadership principles we really care about in our mission and our vision is really the most important thing that we do here.
Yeah. Well, let's talk a little bit specifically around like a leadership team and at any level of leadership. When you're interviewing, like if there's an open position, how do you go about identifying the qualities you need for that role beyond the technical skills and, thinking about your culture or anything like that? What are some things that you do to make sure you're hiring the right talent for leadership?
Yeah, I'll also tell you here at Baptist, it's almost death by interview a little bit. And I say that facetiously, but we take it really seriously hiring the right people. So we involve all members of our team in our interviews, whether it is a frontline position or whether it's a leadership position, to make sure it's the right fit. Characteristic wise, for me personally, trust and communication are the essential ingredients to be successful. I say that because when I think about healthcare, I can't think of really any other industry that is more trusting. Our patients allow us to poke them, prod them, roll them over. I jokingly say it's the most expensive hotel you'll ever stay in and you won't get any rest. But it is because of the trust we build with our patients and their families that we're able to do the care that we are able to deliver. But to do that, it really takes effective communication. It's not only how we communicate with our patients and their family, but how we communicate about each other. I think every one of us are care providers, whether we put hands on a patient or deliver direct care. So that communication of how we set the expectations of when Kyle or Marcy enter the room, I think is really important because it sets the stage for our success and allows us to then be able to provide that holistic care for the whole patient.
Kyle, how do you encourage team members to support each other? How does that become part of the leadership expectation?
Yeah, I'll say that's ingrained in the culture here at South. Since this hospital opened 20 years ago, we've had a group that we call them culture keepers, where they really set the tone and the expectation that when we see a patient or a team member in the hallway, we greet them. If people don't know where they're going, we escort them to their destination. To me, those are the things that set the stage of how we're going to embrace each other and help support each other, no matter what our roles are in the organization. We treat the people the way we would want to be treated in similar situations.
Yeah, I find it so fascinating because you think about the patient experience and so many executives that we interview, they care about the customer experience.
That's right.
But when you think about the patient experience and your customer being somebody that's in your care, there's nothing more important than you having a culture of caring, and whether that's for the patient, for each other, and things like that. That's huge. Do you find it to be something that's difficult to maintain and making sure it's embedded in everything you do? Or how do you go about doing it on things that might be on, beyond like interacting directly with the patient?
Yeah, no, I think you've nailed it. It's tough. I mean, it takes constant focus to be able to maintain that culture. And I'll share, I think where we sometimes get challenged, and I'll cite the pandemic when staffing challenges are really at a peak. If we can't bring in full-time team members, it's hard to maintain a culture when you don't have that consistency every day. I think it's much easier to do when you're working with the same teams over and over. So for us, it's one of those, our team helps hold each other accountable in that. We don't want to call out because I'm going to make life tougher for the rest of my team. And my team will be calling me to say, Kyle, are you okay? Why aren't you here today? And I think creating that camaraderie, and I'll go as far as saying that family experience with the team really pays off in the way in which we're able to then surround our patients and their families. There's a unique book that I would even push out there, and it's called The Patient Comes Second. And ultimately what it is if you take care of your team and the people who are taking care of your patients, ultimately that'll trickle down and everybody's going to benefit in that pipeline. And to me, that book has always resonated with me because I think there's a lot of truth that if we take care of our team members, they'll take care of everything else for us.
Kyle, you talked about staffing challenges. What advice do you have when new executives come into your system? If they've been to another hospital or even another part of the country, I heard an interesting study that where one doctor had been in one system in, say, Colorado and moved to like New York State, and it was an entirely different system, and their practice changed because of that. Now, do you have experience? Do you have advice for somebody who's like new to the system?
Yeah, and I could say you'll even find those differences if you go from one of the Baptist hospitals to another. And some of that just has to do with the patient populations and the communities we serve are different. And I'll say even when I've moved further and further south, eventually in Florida, there are definitely a difference based on where you are in the country. For me, I think those first 90 days are critically important. And what I would say is for any new leaders, it's less about what you accomplish in the first 90 days. It's more about the relationships and the trust you build with the team in those 90 days. And I think it's really about seeking to understand and making sure you're taking the time to not only understand the people on the team, but understand the operations, because the way in which our organizations function can be different, but we ultimately still get to that same outcome. But asking questions and taking time to digest that information and really process it and make your own sound decision, I think will pay off, even though it may not seem like you're getting a whole lot done on the forefront.
And so it's interesting because trust, you can't really put a measure to it, but without it, it's hard to lead. And especially like I haven't read that book, but it sounds fascinating where the patient comes second. Trust with the team first. So your new person coming in, you got to build it within the first 90 days. So then that way they know that they can follow you as a leader. Are there any, how do you do it? Like, how do you get the leader to come in and say, don't worry about this deadline. You're coming in for this. Usually there's a reason, like a reason for somebody to come in. So they have all this like workload they want to get accomplished, but how to slow them down to focus on building trust. Any techniques or advice you have there?
Yeah, I think that's part of my responsibility is I'm hiring a new leader to the team. We've got to make it safe where they can have that time to be able to go out there and build those relationships. And I'll even say when our board hired our new CEO, I mean, they want him to meet 100 people in 100 days. And I think that is paid off tenfold by taking the opportunity to learn those relationships and learn the people on the team. So we as leaders got to make that possible. And it's hard sometimes because we are so goal oriented, KPI driven, that we want to be able to get things accomplished. And we're so tasky. And in healthcare, we're very guilty of being task oriented. And how do we move on? But we've got to give permission for that. And even as leaders, I think we need to assume the responsibility for some of those day-to-day operations until our new leaders can get their feet under them and they have those relationships. For me, being present goes a long way. For a new leader, it's one to be somebody who leads from the boardroom versus somebody who leads out from the floor and gets out to know their team. And I think that's really important. Our team respects you for that. It's a lot easier to ask for something to be done when I can associate who that leader is and you know them on an individual level and they know my name when I walk through the hallway. I think that goes a long way. And I know that's harder based on sizes of organizations. For us, I mean, we are very intentional about making sure we take times on nights and weekends to come and spend time with those teams that only work those hours. Yes, that's a sacrifice on our end, but I will tell you those relationships and that commitment of time ultimately pays off in the long run.
Well, what's the expression? It's not the way, it's the way you make somebody feel that matters. Yeah. I know my day job, which is I work at a college, and one of our initiatives is that we learn every single student's name. Now, I always tell them it might take me to the end of the semester, but I will remember your name by the end. And that's one of the biggest challenges. But when you recognize someone's name,
Yeah.
they feel it, and it builds a connection, because knowing someone's name, knowing how to pronounce it properly, which, by the way, I mean, anyone who's listened to any of my podcasts, I butcher everyone's name. And I tell that to my students as well. I'm like, I'm sorry if I'm going to get it wrong, but eventually I'll get it right. But I keep trying, I keep working on it. And it's so important.
No, you're good. And I'm grateful we wear name badges with 1,800 people. And so it's a nice little cheat sheet.
So one thing that I always love about hospitals, I mean, so again, on the patient floor, the doctors and nurses do the roundings to make sure the patients are okay and, being well served. But at the leadership team in the back office, you also do like leadership rounding. So whether you're in a hospital system or not, I think with this Above Center Leadership podcast, it's kind of nice to hear how a hospital leadership team does roundings with their team, modeled off of the patient experience. Can you just share how that works and how you make sure you prioritize the time to do roundings?
Yeah, I'll share how we do it here. Is we literally block our calendars on Wednesday mornings to round from 9 to 11 o'clock. And we do it in a unique way in that we pair a clinical leader with a non-clinical leader. And then every month we rotate who is with each of those leaders. So one, it helps us get out throughout the organization, but also creates that consistency. So I have an opportunity to get to know the cardiology area of the hospital and that team over a period of time, and are able to build those conversations over the month, but then move on to the next area to be able to meet more team members. The other thing that we do is every quarter we do what we call open forums, and we schedule those at all hours of the day, where we really want to hear the voice of our customers, and be able to hear the feedback from them directly, because oftentimes there's things we can address in real time to make their lives better. Even when we're on rounds, I think people fear that it's all going to be negative, but you also hear all of the really positive stories. And for me, I actually encourage the team every day, every time we go out around on Wednesday, to write a handwritten note to somebody's house and send it to them. The reason why I say send it to their house is, as we've gotten older in life, it's not very often we get things in the mail we want to receive. So we get to do that and open that in front of our families, in front of our kids. And I think that goes a long way with people. And I'll tell you, I get a lot of positive feedback from that as I round, and people say, do you remember the time you wrote a letter about this to me? And I just think that goes a long way. It makes people feel special. It goes back to what you said. It's how we make people feel. It's less about what we do. And I think we live that, and we really incorporate that within our values of the organization.
Yeah, that's so thoughtful. It is the little things. And sometimes the little things in our state of busy get too overshadowed, like, oh, I just didn't get a chance to do it, lost its moment. But to have that real commitment to it is wonderful. So one thing we love doing on our podcast is we ask you for an above center quote. And I'm going to read yours because I think it's so good. And I would love to hear like the background of why this is a quote that's important to you. So just to read it, it's from Margaret Mead, if you haven't heard it yet, but never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. I think that's such a beautiful quote.
Yeah, so this is a quote that has resonated with me for a while. I'll tell you, I first learned about this quote because outside of work, I'm involved with the Scouts, and we incorporated this into one of the productions that we did. And it was really speaking about community and scouting, and the impact that we have may not always be realized immediately, but it can be realized over time. But in healthcare, and I'll tie it back to this, and I share this quote at every one of our campus welcomes or orientations, is I really reflect on the last 5 years of what healthcare has been through the pandemic. This campus flexed to see 130% of its capacity to serve the COVID population, more than any hospital in this region. But we were able to do that not because of our buildings, not because of our technology or because of our equipment. It was because of the people that showed up every day to care for our community. And I really think the people on this team are that thoughtful, committed group of citizens that have changed the world for our community. And that just resonates with me because I think it's a special person who gets into healthcare. We're often called to healthcare because we want to have an impact on others. And I think it's a really rewarding job and a really rewarding career to go into healthcare because of that.
All right, Kyle, you mentioned Eagle Scouts, close personal relationship. I have an Eagle Scout at home. And They call it a heart attack eagle. He got it like 2 days before his 18th birthday. He completed everything. So mom was having the heart attack. He was just living his best life. So tell me how young people, when they start to get involved with organizations and really challenge themselves, how does that help them step up to become leaders in the future?
No, first, congratulations, and nobody asks you what age you were when you got it later in life. So, but
But
you
now
can
it's on our
guarantee
podcast, so it's public.
that's right. I'm not telling anybody. But no, getting involved with a program, whether it's Boy Scouts, Girl Scouts, or an athletic team, it shows your commitment. If you're able to carry something through from being a young person through a young adult, I think that really establishes you as a leader and somebody who's willing to put in the hard work to demonstrate that resilience. But you could also build relationships and trust with those around you, whether they're your peer group, whether it's those who are older than you. I think a challenge with an Eagle Scout is you have to be able to influence people above, below, sideways to you to be able to accomplish your project and to get to that end goal. But at the same time, they're surrounding you for their success because they believe in you. I encourage everybody to get involved with an organization. When we hire people, we look for the well-rounded person, not somebody who just had the academics or the correct coursework. We want somebody who's going to be a part of this team and influence this team in different ways, and help us be a better organization and challenge us to be better and serve our community in those different ways as well.
Is there any moment from you being an Eagle Scout? So just go back to your pre-18-year-old days. Is there anything you learned from them that you still kind of reflect on, like, wow, this really had shaped part of my leadership today?
Yeah, absolutely. And nobody believes me when I say this, but I was a shy kid growing up, and I wasn't the popular kid. But scouting brought me out of my shell. It's what taught me how to speak to people, feel comfortable being in front of people. It allows you to be who you are. And to me, that is the biggest value I think I've taken away from the scouting program is just be you. Don't be anybody else. If the organization isn't going to accept you for who you are, it's not the right organization to go and work. There's nothing you should give up for that career or for that position. You need to be able to be authentic and really be able to live out that best way, because then you're your best leader. You're the best person around you, and the people want to be around you if you live that way.
Well, it's such a simple piece of advice, like you be you and be the best version of you can be. Because if you can't be the best version of you in a certain culture or environment, then you're in the wrong place. So
That's
if you
right.
keep trying to mold some other place, like I love that you said that. I think that's so important for people to remember. And also bringing it out of people. Sometimes the younger, like the next generations of leaders, we need to make sure we foster their authenticity and doing it in a way that they can fit into the culture, but also not lose themselves.
Yeah, I mean, culturally today, we're trying so hard to blend in, and whether it's through social media or other outlets, and it's hard to be authentic. But I mean, I'll share a quote my dad always gave me is just don't ever forget where you came from, and to me that resonates as a leader. If you treat people the way you want to be treated in a very similar situation, you're going to be successful. And people will respect you for that, even when you're making a decision that they may not agree with. But my dad also said that because I grew up in a blue collar family. Neither one of my parents have any formal education. But if you treat people just the way you want to be treated, it pays off. And to me, it's just as important for me to go round with the housekeeper and the dietary team members as it is with the surgeons and the nurses who are providing that hands-on care. And again, it comes back to everyone as a care provider and plays a very important role in what we're trying to accomplish here as an organization.
Yeah,
It's so true.
there's so many people that are just fearful of other people's opinions.
Yeah.
And when you provide an environment that allows the trust to build and allows people to be their authentic selves, then that fear dissipates. And then we end up building stronger teams.
Yeah.
Yeah.
I agree. And I'll just share, like when we fired one of our recent leaders to our senior team, and we all did strength finders and the Hogan. And the reason why we did that is we wanted to find the leader who best fit the gaps on the team. So if we allow everybody on that team to be their authentic selves, it then allows us to be able to challenge each other in safe ways and ultimately walk out of the room with a single voice, but being sure that we're representative of our entire community, entire team that we're serving. And I could tell you, to me, that has served us very well with the leaders that we have brought on the team. And I know Marcy's been able to experience that as a board member with our organization. in different ways too. And I think that's what sets us apart from others, is because we do create that safe space for everyone to be an individual that ultimately is a contributor to the greater whole.
Yeah, I've always been so impressed by your team, it just being so open about where you all are different. So a lot of times when people are open about somebody else's differences, it's usually with a slight little bit of a negative tone, like, oh, you'll catch up. Like, you're not like us, but you guys are more like, yep, this is how we are. And then it gives people permission to like ask for help or jump in. You can't be perfect in every area, but I do feel like you guys, I think it's like you said, it's like that family, that trust that you built, that you're allowed to be like, well, I can't be perfect in everything. So here's me.
And we allow people to leverage their strengths. And I think if we do that, people can really flourish, and
Yeah.
ultimately we all benefit.
Yeah. So I'm going to go back to just a little detail you were mentioning. You're like talking about getting, how people feel very, remember, where you came from. And then you quickly mentioned, I'm just as comfortable rounding with the surgeons, which you would think a hospital president should, right? As I am with the janitors, as I'm with this. And like, I think that is it was just like a little detail, but I think that's an example of great leadership, that you are bringing out the best in everyone. Cause I know when you go to the hospital, especially if it's in the emergency room, the person giving you directions is probably the most important person when you roll up, and the way you make your team feel so included. Like I know the security guards and everybody, like they're all a part of this family that's willing to like help however, and that's just so important it's probably one of the reasons why you have such high scores, because everybody contributes to that welcoming feeling.
No, thank you. And I think it's important to embrace everybody for their unique abilities and their characteristics. And if you really spend time getting to know people, it's fun to hear why people went into the career they went into. And there's usually a very defined reason that has driven them to that. And I don't think that's unique to healthcare. But I mean, there's like the story out there when rounding in a hospital, somebody, an anonymous, walked up to a housekeeper and just said, "What's your job here?" And the response is, "My job is to take care of the patient." And I think if we have a culture where that's what we're doing, I think there's nothing we can't overcome. There's not a challenge that can come our way that we won't be able to move forward and beyond. I think we really saw that during the pandemic. It didn't matter what roles people play. People still went into those rooms to take care of the patients, even when we didn't fully understand the disease at that time. Environmental care team members still went in the rooms and cleaned the rooms. It's food and nutrition still prepared meals and delivered them to the rooms. It's ultimately, if we do what's right for the patient, I think it'll pay off in the end, and embrace each other for our unique abilities and treat people like individuals. It goes a long way.
Yeah, absolutely. All right. Well, I'd like to take the conversation a little negative for a second.
All right.
So our above center philosophy is basically like living your best authentic self, and like from that vantage point, be the leader and the person, the friend that you want to be more often. But there is life that happens when stress happens and you can fall below center. And sometimes from that fearful state, or that feeling like left out state, or whatever, like if you don't feel like enough, from that negative below center point of view, you react. Any advice, and especially since you mentioned during the leadership during that time in a hospital system, I mean, I think the real leaders shined at that moment to keep things going, and people, less fear and things like that. But any lessons that you've learned on when somebody falls below center and they're legitimately below center and they're legitimately acting below center, any advice you have to help people reframe, or at least not behave below center and choose something that's a little bit more matched to their better self?
No, I think that's a great question. And I'll say the number one point in the Scout law is trustworthy. So I'd be lying to you if I haven't said I've never fallen below center. And I think the key is we've got to be able to create a culture where we can call each other out when we're below center. But to be able to do that, it's got to be a safe culture. And by that, it doesn't mean we embarrass people in a meeting. It's getting people one-on-one, truly understanding what's driving them to behave in the way they are. Is it a factor at work? Is it the stress of the environment they're in? Is there something going on in their family life? And I'm not a psychologist, but my belief is people want to do good and don't, show up innately wanting to be negative or pull people down. If we understand the why, I think we could then help provide people the resources that they need to get above center again. And we've got to do that in a safe way. I think we have some very unique things here at Baptist Health with chaplain services, with employee assistance programs, even financial funding to be able to help people deal with the cards that life can deal them at times to be able to get over them. And sometimes that may be removing people from the environment they're in and finding another environment that can better support them here still on the same team and making it, again, a safe transition for that to occur. And I think it takes a real leader to be able to make that happen. And it's not always easy. And for some people, I think where the challenge is, it takes longer. It could take me a day to bounce back and take somebody else a week to bounce back. But it's being patient with people as they work through those challenges that they're facing.
Kyle, this has been such a interesting conversation. I love your perspective, and the idea of trusting and building a team and being able to allow those team members to thrive in the environment that they will do best is such a gift that you can give your team. And I really want to thank you for joining us. I have one quick final question. Do you happen to have your mug with you?
I do. It's right here. Thank you.
Yay.
Look at that. There it is.
It's a quote. Well, Kyle, so great to see you.
This has been fun.
Yeah, thank you so much. We really appreciate your insight today.
You know, Marcy, when people go to the hospital, a lot of times they're at some of their worst moments. And it's so challenging for the leaders to make sure that their team is supported because they're having to deal with people in these moments of vulnerability.
Yeah. Well, especially like families are scared and they're confused and they're stressed and they just, it's hard to get like all the answers you want. And out of that, frustration can come. So if the practitioners aren't, feeling above center, they won't, find the right words to make sure the patient's hearing. But I love Kyle's story. I think he does such a good job of nurturing a culture where everybody is there for each other. And I hadn't heard him reference that book before of the patient comes second, which is fascinating because usually you're always like, if you treat the customer well, everything else works. So I'm curious how that book works. But the second he even mentioned the title, I'm like, that makes sense.
Yeah, I've heard that before as well with the idea of restaurant service, where you treat the staff, you treat the servers really, really well, and they in turn will share it with the clients that are coming in to dine with them, and then they'll come back because they had such a good experience because the employees are happy.
That's so true. That's so true. Happy employees, happy customers. Great to see you.
Great
Thanks,
to
Allison.
see you. Always better together.
Learn more at thererebelcompanies.com.
That was fun.